Hello and welcome to the Vestibular Disorders Association, Making Vestibular Visible. I'm your host, Dr. Kathleen Strauss, a neurological and vestibular physical therapist and VITA volunteer. Today we'll be talking about blast wave injuries and the vestibular injury that results from near or far exposure to explosives. Whether due to an isolated act of terrorism or an ongoing regional conflict, the impact of explosives is severe. And it's been estimated that 1 in 8 people globally have been exposed to conflict in 2024. And this includes those living within 5 kilometers or 3 miles of violent events such as bombings and explosions. The ongoing conflict in Ukraine is one of the places where soldiers and civilians alike have experienced war-related injuries. And today we're honored to be speaking with Professor Konstantin Trinus, a distinguished medical profession from Kyiv, Ukraine, who's been in the heart of the Ukraine conflict and brings to us story of his firsthand information about the impact of war and explosives on the vestibular system. Welcome, Dr. Trinus.
Highly estimated audience. First of all, I would like to thank you, first of all, to the organizers, Dr. Cynthia Ryan, Dr. Kathleen Ross, highly estimated Vestibular Disorders Association, the audience who listen us, and American people, because in the health situation of our country, I was the military volunteer first days, and we have got lots of medicine necessary from USA, also from Europe and other countries, but we are especially grateful to Ukraine, to American people.
Well, thank you for that. And let me just add that we have an audience watching this today that is global in nature. So certainly it has been a conflict that has had the attention of the whole world. And people listening will be from all different countries today. So thank you for that.
We are grateful to everybody.
Very good. Well, thank you for bringing this to us. And what initially, I know that you're a neuro-otologist in your country, and before this conflict, you focused on the vestibular system in research and practice. Can you tell us a little bit about that and what led you to really begin investigating vestibular effects of blast wave injuries?
Well, thank you. This is a very interesting question. And I'm studying vestibular system from 1982. In 86, when Chornobyl accident happened, I was signing the permission to the high place to the workers of 3 trusts who have repaired the plant. And I was following up Chernobyl contingent for about 25 years. And I have seen the long-time consequences of the vestibular injury. And the most cunning feature of these consequences is imaginal well-being, when everybody feels that the injury is over, but after 2 years in my occasion, this was, let us say, mild injuries. After 2 years, there started small vertigo dizziness episodes, which increased in frequency and intensity. And then after that, there appeared headaches. And in several years, it became organic neurological symptomatics. And as my friend, Professor Nikolenko from Donetsk, studied, there was the failure of immune system. And of course, after that, chronic infections, autoimmune, and oncology increased.
There's a
What?
you said you said a lot there, and it's amazing because when our society experiences something, we get into a triage mode of the immediacy of it and what happens immediately, but then it takes time to study the long-term effects. You said 25 years of studying the Chernobyl impact and the long-term effects. We're in this country and globally looking at long-term effects of COVID. And so the story changes and it continues to evolve. And I know then in the same is true for exposure to explosions and these injuries, that you're looking at what are the long-term effects. Certainly it is something that deserves continued study. And so now looking at long-term effects, and for those who thought they were well, you're saying you think you're well and you think you dodged the bullet, if you will, but then you see occurrences of symptoms far after. And is that for people who are even far removed from the events, or have you determined an area or region that is most likely to have experienced impact even long term?
Okay. First, it was 2014 when I had the first patient with blast injury. This was a young lady, a volunteer who was visiting zero line, as we call it, with medicaments. And she told me that next to her, there was some explosion. And after that, she felt balance disorders, dizziness, and sometimes severe vertigo episodes. So after that, I decided to study how the explosion, which has not reached the patient, can do this. Again, I have found American article when they have studied in Nevada the explosion of 1,000 kilogram TNT, and they find the most important part of the explosion, 5 hertz infrasound. And this infrasound wave, they have recorded 46 kilometers paraseismic or surface and 130 kilometers in the air. Russians are attacking Kyiv with Ha-101. I do not recollect now the exact NATO code of this rocket, but it has 960 equivalent of TNT. So it's close to the Nevada experiment. So it also has the same characteristics, and the Kyiv from west to south, from west to east, and from north to south is 42 kilometers.
Mm-hmm.
So 130 or 46 and 42. And this rocket has attacked this children clinic, Ahmadit. It was worldwide known history, and
Correct.
it is in the center of Kyiv. And I have the reports of dozens of attacks of these type of rockets. I do not say about smaller rockets. I do not say about drones. And in 80s, I remember the first paper of French colleagues, Yves Casals from Portman Institute, who have shown that this was vestibular system to sense the infrasound. And this means that it was not trauma as usual trauma, but it was the, how to say, overload or overscheduled impulse at the vestibular system.
So, would it be correct to say that this is a low frequency vibration that the whole body experiences that may be the root cause of these vestibular injuries? It's this whole body low frequency vibration?
Yes, to some extent, it might be said like this, but it is possible to hurt the skin with a strong light, but the eye can see separate photons, very low level. So the same is with the vestibular system. Of course, we feel this when the rockets are in Kyiv. I feel my chair to jump up sometimes. So we feel it also with somatosensory system. But vestibular is the exact sensor, and it is disturbed or impacted the mostly.
So it's very sensitive. And I think what you're revealing is that it's much more sensitive than we imagine, because under these certain extreme circumstances, the vestibular system is vulnerable and sensitive to these kinds of injuries. Now, so that's the vibration impact. And then in looking at the definition of blast wave, that has to do with a movement of air. Is there an impact of the wave of air movement also, or is that just an impact close to the explosion?
I have studied the explosion. There are several stages of the development of the explosion. The development of the nuclear of explosion, then the shock wave explosion where the air is moving and the particles are moving, and then long-term acoustic wave is moving, but acoustic wave decrements much quicker than the infrasound wave. The most important appeared to be 5 hertz, according to this American Poppenhauser. They also, in the Nevada experiment, he has shown this.
What are the most important, or what are the most common symptoms that you're seeing in these vestibular patients in the area? What are the most common?
In 2016, we have prepared the International Clinical Protocol, and it is present in English at the site we have spoken about. There are dizziness. This is the distortion of the sensation of movement, space, and time. A patient of mine say that in order to come to his yard, he has to cross the line of the opposite direction traffic. And 2 months or 3 months ago, it was easy to him to find the proper time to do this. But nowadays, he stay and wait when all the traffic will pass, and only there he has the courage to move across this stream. So this is the disturbance of the space, time, and movement. The vertigo, this is the illusion of non-existent movement. Very often it is rotational. Sometimes it might be other directions. And we distinguished 3 types of movements. There were the articles of Germans and Americans, American neurologists. Objective vertigo. This is the feeling when the subject, the world is running around the patient. Subjective vertigo. It is the patient feel himself moving when he is not moving. And giddiness or pseudo-vertigo. Adams and Brown, Americans, very big and very nice neurology handbook, I like it very much, have shown that this is giddiness is pseudo-vertigo. And my patients say, I feel myself as if something is moving inside of my hand, of my head.
Yes.
So these are the most important. And if we will take the German population, Neuhauser and Lambert from Germany have made epidemiological studies of vertigo dizziness in Germany. And they told, or they have written that 23% of the normal population, not hospital population, have these complaints.
That's about 1 in 4, and I think that's the numbers we go with too. Is that 1 in 4 people will experience vestibular symptoms at some point in their life, and that is an incredible number.
Almost the same, say Desmond from USA. Almost the same data. And when I have studied my groups, I have three groups. One, veterans from former years. Then the acute cases from zero to Kyiv. And I have studied the complaints of my students. I was shocked, actually. Why I was shocked? Because, well, it is understandable that veterans have about 80% of the veterans have these complaints. The acute cases, they have close to 70%. And my students have 50% of students have these complaints. And we have seen the possible mechanism why we consider this to be objective. We have the possible mechanism, the 5 hertz, the vestibular system. Then we have studied pendular test. I suppose that for many patients it might be known. For the doctors it is known. And we have seen that there were a lot of patients which had nystagmus, spontaneous nystagmus. I do not say about the pathologies of pendular test. And we have studied coordination tests, like standing on one foot with eyes closed, marching with eyes closed, and some others. And we have seen that there are objective proofs that it is not only complaints. It is not only psychological. They have the
impairment in vestibular function with the eyes, with the eyes, the equilibrium,
vestibular, ocular, and vestibular spinal reflexes.
Right. So just for our audience to review, the vestibular symptoms objectified can be measured by measuring abnormal eye movements that would be demonstrated by abnormal nystagmus, or those fast and slow beating eye movements. Secondly, by an abnormal perception of motion. Either you're moving or the room around you is moving, or you feel like something's moving in your head. And Dr. Trinus accurately described that as objective vertigo or exocentric vertigo, subjective vertigo, egocentric vertigo inside, and then, or the giddiness being inside your head. And then the third thing is abnormal equilibrium, that with a marching test or standing on one leg, you would see vestibular damage by the inability to maintain equilibrium. So these are, you're saying it's objectified. It's not just a stress response or an emotional response to the thing, but it is objectified in the clinical tests, that your students who weren't in the battle or in the military were experiencing this in high numbers. Okay, continue. Thank you very much. Keep going.
Well, what should we speak about the next complaints? The so-called kinetosis or seasickness, air sickness. The patients say that they cannot suffer the traffic. They cannot stay the transportation. And
sure.
First I met this in the acute in the patients with acute traumatic brain injury. I suppose this will be good to explain. Mild traumatic brain injury, this is in American literature is rather popular. Then
let me just interrupt right now. You're using the word kinetosis, and we call that, you said motion sensitivity, motion sickness, seasickness. I
motion
just want to make sure I
sickness,
introduce people to the word kinetosis being motion sensitivity, motion sickness. Okay, good.
I was the student of Professor Claussen. In Germany, in Würzburg. He liked this term. And Professor Claussen was the student of Professor Henriksson. And Professor Henriksson was the student of Professor Barani. So that's right. Why I used this terminology, and might be it is not so popular. More popular is motion sickness. But I suppose that we have agreed the possibility of using this. Then, orthostatics. Professor Gassick from USA have shown that vestibular nuclei from rhomboid fossa has lots of visual, somatosensory, hearing inputs. Then lamina quadrigemina and all the other vestibular nuclei up to the cortex have very tight connections with other sensory system. And first it was Professor Naschner to say the sensory triad, which perceives the space, and Professor Claussen shown or told the hypothesis about the tetrad, sensory tetrad for sensory systems, which are important for space understanding in our brain. And why it is so, why it is vestibular system. It perceives the most important constant of nature. The stone is falling down. Everybody knows Newton, that apple has fallen on his head. But let us ask doctors, and they will not tell that it is vestibular system which perceives vertical. And
vertical.
Having gravitation vector, let us. But this vertical is connected to horizontal. Horizontal is perceived by somatosensory system. And then visual and hearing systems are making the understanding of the depths of the space. So 3D space understanding, perception of 3D space perception, orientation in this space, and interaction with this space is coordinated by the vestibular system, because it has very strong connections or relations with motor system, with vegetative system and with limbic system. And for example,
yeah. Go ahead.
Sorry?
I was going to say, I'm interested in the limbic system connection specifically, but I want to keep going on where you are in relating the injuries and the central nervous system connections and talking about mild traumatic brain injury versus blast injuries. And so continue
Yes.
about these, but because the injuries could be to the peripheral vestibular organ in the inner ear, or are you saying also to some of those interconnections to the central nervous system throughout the brain and the cortex?
Well, when I was involved in neurophysiology at the cellular level, it was my PhD before 82, before I started vestibular system. We have seen that strong activation of the membrane of the nervous cell causes the changes in the intracellular reticulum. It's if you will take some dyes and color this reticulum, and we tried this. Usually they try this in morphology, but we have tried it in physiology, and we have seen that the spots of this reticulum after several hours are going closer to the nuclei of the cell. And we have suggested that the strong activation of the cell membrane causes some activation of intracellular actins, and then it causes the changes in DNA and in the long time changes of the cell function. So this might be the explanation of the long-term consequences of the vestibular injury. And we have seen, among others, migraine. For example,
Yes.
among my students, migraino's character of headaches I've met in 40%. And this is much more than in the usual global 18% of global population. Among veterans, 38%. And those were mostly male. Male has in global population 6%. And we had 38 among veterans. So what should we have? Then it was not related to blast injury, but it was a long-term examination of vestibular system. I have studied, let us say, about 70 persons with treatment-resistant hypertension. And only the correction of vestibular function decreased blood pressure almost to normal levels. And this was much longer than the use of hypertensive medications.
Sure. I think we are acknowledging more and more the impact of vestibular injury on the central nervous system. And we talk about the autonomic nervous system quite a lot in with the community of Vestibular Disorders Association to talk about the autonomic nervous system's impact on anxiety, blood pressure, and body functioning, being that the body is in a constant state of fight, flight, or freeze. Everything in the nervous system reacting to stress because of the vestibular injury changes the entire constitution of the person, from their heart rate to their blood pressure to their ability to concentrate and function and think and remember. And you're talking about these proof of these and the evidence of these inner ear injuries having an impact on the brain and the whole functioning of the individual, and the nervous system components. It's quite amazing.
And you have mentioned the cognitive functions.
Yes.
I recollect this München paper from Brandt and Company. You know this team. They have shown that the lesion of vestibular system causes the degeneration of the nucleus caudatus, which is responsible for the memory and cognitive functions. And a team in Kyiv was studying the blast injury in military with cognitive evoked potentials. And they have seen the increase of the latencies of P300 in the patient with blast injury. So
that's very important, because I think that we tend to tell most clients with peripheral vestibular dysfunction that their cognitive problems are going to resolve once their vestibular system has repaired, because we say that, you know, the memory and concentration problems come because your brain is preoccupied with maintaining vertical or maintaining stability and balance and equilibrium. And you're proposing that that's not true, and that those cognitive problems may not only remain, but may worsen. And I think that's a very interesting hypothesis about the vestibular injury's potential progression into other neurological functions.
Yes, thank you. And if it is possible, I would like to say few words about the theory of the vestibular system, because when we were analyzing the vestibular, how to say, morphology of the sensor, of the labyrinth, it appeared that there are 6 sensors in the vestibular periphery, among them gravitation, acceleration of movement, magnetic sensitivity. This was joint team of American and Spanish scientists, Dennis O'Leary and Campos Munoz from Spain. They have found magnetic particles in the maculas of labyrinths. This means that we can feel magnetic impulse. Where do we feel magnetic impulse in the living nature? Cloud negatively charged cloud against positively charged ground. And when it is moving, it is magnetic impulse. Then two clouds coming and we have thunderstorm. With
Thunderstorm,
lightning,
lightning and thunder. Mm-hmm.
and these are magnetic impulses. Then magnetic storms, these sun magnetic storms we have. But now we have lots of retransmitters. We have magnetic smog over the earth with handy, with space internet. I had a patient. It was before the war, who came to me and say, 20 minutes with handy, and I feel myself as if I am in a severe sea storm. During magnetic storm of the sun, up to vomiting. I'm sorry for this word, but this is...
That's okay. Are you speaking about a cell phone? Are you talking about cell phone usage? You're calling it handy. Okay, from a cell phone. I see. Mm-hmm. Cell phone usage and mm-hmm.
He tried many anti-front medications with no effect. I have recommended him to make screened room, ground it, and he came. Oh, I feel myself as if I am born another time. So this was the way out to him. Now we have many drone operators. I do not mean only blast injury or front. I mean that now we want to ask by internet some meat and some goods, and we want drone to bring it to us.
Drone delivery, yes. We were talking about that the other day, that we had drone delivery from Walmart here until the drones were spotted in New Jersey, and then they stopped. So I don't know if drone delivery is still occurring as frequently as it used to, or if they were getting shot down, by nervous people.
I do not want to discuss use benefits and shortcomings of different, how to say, products of progress. Mm-hmm. But we have to study health results, benefits, and how to escape the problems using our knowledge. Might be my knowledge is very little because I am involved only in one area. Everybody considers this area very small, but I see that it is not very small. And in some countries, I would say it is my country. I see that Israeli will have the same. I see that Americans who were attacked by Hussites in the Red Sea American military, they might have this. I do not say about Russians, Koreans, about this old proxy, but among them there are also people who suffer from, let us say, aggressive individuals and who are not guilty for their crimes. And these people will also need high-level medical help. And
so is your country responding to this need with awareness and vestibular centers for people? Is there public awareness and education campaigns about some of these symptoms?
well, I am doing my best, but the public awareness is very low. This is first problem. Second problem, the long-lasting delayed consequences. I proposed several times that we need to make the international register of the vestibular patients to have the possibility to monitor them and to improve their management.
Yes. So the Vestibular Disorders Association does have a registry, and we have been working with individuals to try to enhance the function and the capabilities of this registry. So the organization agrees with you in this need to capture the frequency of vestibular disorders and to monitor them short and long term. I think that is a great global effort that certainly we share, to really look at the incidence of these vestibular problems and the longevity of them and the impact they have on people's quality of life. Yes. So
that's great, and I would like to join your efforts in this part, and I'm eager to share you my knowledge. My knowledge, it's not only it's the Neurological and Equilibriometric Society and many years of the Würzburg University, and this was also Professor Schulman from SUNY State University of New York, who is great in the tinnitus and also in my patients, and especially in blast injury patients. There is big amount of a big percentage of patients with tinnitus, and Schulman and Claussen have presented a very good classification of tinnitus. So we have used this, and they have a paper which have shown that there are types of tinnitus which are related to the vestibular system. So
yes, the tinnitus is tricky. It's not all one kind, and I think that vestibular tinnitus is certainly a problem. And so are most patients getting treated with medications or rehabilitation? home exercises, or are they not receiving treatment? Do they look to the internet to get help?
Well, patients like to teach professors that they have studied that internet they have, or they recommend to doctor or to professor to prescribe them this or that type of medication or management. I suppose that complex management is the best one. Medications, exercises, diet. Diet is very important. Everything in the clinical protocol we have made, we have spoken about more than 500 medications. I suppose it might be close to 800, but I am not sure. And Alain Desmond from USA told that there are about 1,000 medications for dizziness, and dizziness might be among the side effects. So
every one of them, every medication lists dizziness as a side effect. And while we love to have side effects listed, that actually does our patients harm, because sometimes they're afraid to take medicines that they need because everyone lists dizziness as a side effect.
But we have seen that if we differentiate dizziness, vertigo, different types of vertigo, orthostatics, then the disorders of the space orientation, like height vertigo, supermarket syndrome, nyctophobia, this is the discomfort in twilights and in darkness. If we differentiate, we can find better treatment for these patients.
Agreed. And I really appreciate this really just introduction into the topic. It sounds like that there are many more areas we could dive in deeper to compare and contrast brain injury versus blast injury, to look at the short-term effects versus long-term effects. But what I think I hear you telling us is that we need to strap on our boots and get ready for the world experiencing vestibular disorders at an increasing rate, even long term, and being sensitive to those war-ravaged areas where people will or may experience long-term effects of these things. People who, don't originally think they are impacted by war, but that they are in the long term. It's going to be very interesting to watch. It's not the way we want to make vestibular visible, but we do want the world to recognize the importance of the vestibular system, how integrated it is with all other types of brain and nervous system function. The vestibular system, I say, being one of the most primitive system in life that is essential and impacts so many other systems. I appreciate your passion for this topic, and I appreciate you coming on today. And our hearts, minds, and prayers are always with those areas that are struggling from unrest. And from the healthcare perspective, we all are interested in finding solutions to prevent civilian involvement in unwanted attacks, and short-term and long-term. So I'm going to give you the last word of anything else. If you think that something that maybe our audience doesn't know, that you want them to realize about your experience and what those in the vestibular community globally can understand from your experience in Ukraine.
Well, it's not only my experience, it's also lots of articles from worldwide. Also, my very good friends from USA, from Germany, France. What I would say that few years we were speaking about the questionnaires for evaluation of the complaints of vertigo dizziness. We were speaking about this, and we have been also spoken about the very simple tests which can every family physician use with this smartphone,
right,
with video recording, and we need the centers where the high-level specialists can use telemedicine to consult the family doctor, let us say, in high mountain of Himalaya, when he has the patient with this. So this is, let us say, what I was trying to do last years together with my friends and colleagues, and what I say, or it seems to me that this is very important for the whole global population, and we have to do all the efforts to increase the global population awareness of the danger of dizziness.
Yes, beautifully said. And we are happy to partner with you in making vestibular visible, in vestibular awareness among the public and among primary care practitioners. Our goal is with you to simplify evaluation of the vestibular system so that more people find a diagnosis accurately as quickly as possible, and then to understand the best treatments for the different types of vestibular symptoms as they present. So it's amazing, because these are the same challenges that we have during peace or war, is to decrease diagnostic times, increase accuracy of diagnosis, and get people to the right treatment quickly. And it sounds like also really to understand the long-term effects of vestibular trauma in the population. So thank you again. I appreciate your time, and we're going to invite comments and questions from the audience, and we'll continue the conversation. And we appreciate so much your being involved with us. And I invite people, if they're interested in more information, where can they visit you on the web? Did you freeze? happyvertigo.com. So go to happyvertigo.com for more information on the web, and to see more about Dr. Trinus's interesting and extensive literature review on all the things that he spoke about today. It's been my pleasure, and so long for now, and join us again for another episode of Making Vestibular Visible. Thank you, Dr. Trinus.